everyone, welcome to our first YouTube Live of 2023, and we've made it. Thank you for your patience. It's been a bit of a struggle getting here with influenza in January and COVID in February. My voice is still not back to normal, but I didn't want to cancel again. I'm feeling fit enough to do this YouTube Live. So thank you. Hi everyone. Lovely. Yeah, please let me know if you're here. Lovely to see you all. So today, just having a read of your message. COVID as well. Yes, I had COVID. It's my lucky year. Influenza followed by COVID. So don't recommend it, but I'm here, we're here, and we're here to talk about necks. So those of you who don't know me, I'm Jeannie DeBon. I'm a movement therapist who specialises in working with people with EDS, HSD, and the chronic pain that goes with these conditions. So really excited to be here. I've got my skull with us here today. Doesn't have a neck. Hi everyone, so nice to see you all. Hi Beth, hi. Oh, someone's recovering from pneumonia. Yes, that's horrid. I hope you're feeling well. Take it easy, don't rush back to activities. Lots of people here, thank you so much for coming. So we've done in our YouTube Lives pretty much every body part, from knees, hips, pelvis, shoulders, feet. The one area we hadn't really covered was the neck. So I wanted to spend some time talking about the neck yeah, giving you some exercises that might be useful for neck pain, neck instability. So there was lots of excitement at the start of this year because this paper came out that you may or may not have seen. Okay, presentation and physical therapy management of upper cervical instability in patients with symptomatic generalized joint hypermobility. Don't worry, I'm not going to read the whole paper. If you haven't seen this paper, the EDS Society have made this freely available on Google. Just Google it, you'll find it, it's free. So if you are interested in learning more about what this team of experts discovered, so a number of experts came together, including Dr. Leslie Russek, who is a good friend of us at the Zebra Club. And she is actually, if you're a member of the Zebra Club, you'll be delighted to know that Dr. Russek is joining us in March at our members meetup to discuss instability, cervical instability. So that's going to be a good one. Don't miss that one with Dr. Russek. You can ask her any questions about this paper because she was the lead person in the paper. So we're very, very privileged to have her coming to visit the Zebra Club on a regular basis. So yes, there was a paper here. If you don't like reading papers, I did summarize the key points, and they are on my excuse me, social media, Instagram and Facebook. Took out the key points. We're going to talk about some of those anyway today. You do need a band for today's class if you're going to be doing the exercises. If you might need a head cushion, if you have trouble with your neck, please make yourself comfortable. Can I provide a link for the article? I think it's on my social media channels, but honestly, if you just Google it, it's going to come up. If you put Dr. Russek, upper cervical instability, that paper will come up. It's freely available for everyone, which is awesome. So we're talking necks, okay? And you know, this paper was really, really good because until now, there hasn't really been any gold standard information out there about how to treat neck instability. Okay, so when I started working with people with CCI, cervical or AAI, atlantoaxial instability, a few years ago, there wasn't any information out there. So I kind of did my own research, and I spoke to the doctors who do the fusion surgeries. I wanted to understand more about why those surgeries were required, what was involved in those surgeries. I spoke to people who'd had the surgeries. I had clients who had such severe symptoms that, in terms of neurological symptoms, that they had to have the surgery. Okay, so I saw people who were very, very severe before and working with them after surgery as well. So, and I did what research I could online, but as I say, there wasn't a lot out there. So I came up with my own protocol based on the research I did, and it was just very encouraging to see this paper coming up and actually giving us some classification of the different types of instability out there. So in this paper, sorry, I'm just looking at my notes, they classify instability as low, moderate and high irritability. Okay, so they're saying that 52 to 66% of people with symptomatic hypermobility, that's huge, right? 52 to 66% with hypermobility have mild upper cervical instability. So they've bunched CCI and AII together to make upper cervical instability. So up to 66% of people have some form of instability in this region of their body, which kind of makes sense. If you're mobile in other joints, chances are you could be very mobile in your neck as well. Okay, so that's the mild instability. They say that severe high irritability only accounts for 5% of people, according to this paper. So when we're talking severe, we're talking very debilitating, disabling, lots of neurological problems. So, you know, seizures, loss of vision, loss of speech, compression of, you know, jugular veins, etc. So very, very debilitating, and you know, these people are often the ones that need the surgery. But obviously, surgery is a huge surgery, and you know, we need to take that very carefully if we're deciding to have the surgery. But for some people, they literally didn't have a choice. So our general population of us, our hypermobiles, have what they're calling the mild irritability. So, you know, I used to have very mobile neck. I used to have what you might call a flip-top head, so I could tip my head all the way back. I don't recommend trying that, but that doesn't happen anymore because I've managed to stabilize my neck. You won't ever see me, which is another reason why I modified the Pilates repertoire. You won't ever see me doing any kind of backward bend inversions on the mat or on a reformer, because I can still feel shearing of my skull or one of the vertebrae. I don't know what it is, but when I come up, I can still feel that shearing, that clunking. So I don't do any kind of inversions or backward bends inversions because of that reason. So, you know, if you're having symptoms, you know, just be mindful of the sort of exercises that you are doing, okay? So, in terms of interventions, they talk about education on posture and body mechanics, sitting, standing, relaxation and breathing. Okay, so all the things that we talk about on this channel actually, and in the protocol that I created when I didn't, you know, when there was no other information out there, it was very much based on starting with those aspects: breath, relaxation, and interestingly, if you're dealing with neck instability, we've got to look at the whole body. It's not just about this little piece here, okay? So this little piece here is just an extension of this whole piece here. So we don't really have a neck as such. This is your spine, okay? So try not to just get focused in on this little area. Try and think globally, which is what we're going to look at today, okay? Now, just to be clear, if you're listening or watching back and you have what they might call the high irritability, you know, really you want to be working with somebody one-to-one. I don't see any, you know, I always see my cervical instability people one-to-one, because you need that guidance. So I'm not suggesting that these exercises today are suitable for everyone with instability of the neck, cervical or AAI. I'm not suggesting that. They are just some exercises that I use for neck pain and neck stability, okay? Depending on what you're doing, whether you're with a therapist or a teacher or watching a video, none of the exercises should increase your pain, and none of them should cause neurological problems or bring on like slurred speech, dizziness, loss of sight, pain. Nothing should be doing that. So if you're exercising with somebody or on your own and you experience increase of pain or neurological problems, you need to get that checked out, okay? It's really important. So these are just some neck exercises, but they're not going to be focusing on the neck. Now at the back of this paper, many of you will have heard of Dr. Henderson, who does the surgeries in the United States. It says here somewhere, where did I see? It basically says that people with instability should always be doing isometric exercises to help support the neck. Now, I do my isometrics every day, but I've kind of understood the problem I have with isometrics. First of all, with my high irritability people, putting their hand up here to do isometric exercises wasn't working, because just lifting the arm up was causing problems, so it wasn't going to work for them. And the other problem is that if the head is in a funny position already, so if I sit like this, and I talked about this in one of my hypermobility hack videos, if we're sitting like this and I'm compressing the back of my neck, and then I try and do isometric exercises, my head is not in the right place in the first place. So am I going to be causing shearing of those vertebrae because I'm not in the correct alignment? You know how important I think alignment is for any part of the body, because if we're not in the right place, we're not going to be working the right muscles, and we could, end up hurting ourselves. So isometrics, again, they're always prescribed, but I think you need to make sure your head's in the right place and that you can tolerate doing this. And I know you can do it with a ball against the wall and lean against the wall. There are different ways of doing it. A lot of my high irritability people just found, apart from this being uncomfortable, doing the isometrics brought on those neurological symptoms. So we just didn't do those. So there's lots you can do without having to actually focus on this little area here. So if we come back to the head, okay, so just as a visual, he doesn't have a spine, so he's got this piece of wood. Okay, so this is where the hole where your spine goes into your head. So you can see there's a lot of weight here at the front, okay? And obviously we have, his head's fallen off. You've got ranges of motion up and down, and this is where we get the laxity, right? In here, in this joint here. So this then feels like a wobble head, yeah, or it feels too heavy because you haven't got that stabilization. Okay, and then obviously you've got 7 vertebrae here, okay, and people can get instability in different parts, like any other part of the spine. It's not just up here, okay, so again, that's why it's important to treat this whole area, but you also have to treat this part as well, below, to give this little part support. So if I'm all wobbly down the bottom and my lumbar spine is not stable at all, and when I'm walking I'm all over the place, or I'm collapsed when I'm sitting, this is obviously going to be impacted as well. And we know that obviously if we're doing this forward head posture and the head starts to tip forward and forward and forward, this can weigh up to 42 pounds. So it can go from being like 10 pounds to getting heavier and heavier and heavier. So if you're sitting like this and you've got 42 pounds of weight hanging off this joint here, you can see why that might be causing pain and problems and compressions and instability. Okay, so head posture is very, very important. And it really is like balancing plates, right? Can I balance this thing, not very well, on top of a broom handle? Because that's what we're dealing with, right? So it is balance of these weighty structures, the head and the pelvis, are going to be super, super important for that integrity through the whole spine, okay? So something to think about. We are going to look at that today. So what might, I touched on that, so alignment, what else might be causing us problems? So alignment and posture. So if I sit like this and these muscles are all weak and stringy and these ones are short and tight, my shoulders roll forward, my sternum collapses, not very good, and then I can't turn my head properly and it just feels very unstable, okay? So alignment and posture are really important for neck stability. Laxity, obviously if I'm lax, I'm going to have a greater propensity to having this wobble head or flip top head that I used to have. Gravity. Gravity's pulling down on us, so it can pull you into these compressed postures. Okay, we have to learn to work with gravity but also resist gravity, which we're going to do today. Desk environments, work environments, driving, sitting, all of this stuff is going to compress the neck. Yeah, as always, alignment and balance and posture without fixing and bracing, of course. And bracing, I mean guarding, not bracing as in a neck brace. Many people find neck braces really, really essential and important. I'm not saying anything wrong with neck braces. Instability here can often lead to tightening up of other areas. So many of us, and this is another issue we have with the guarding and the fixing of our ribs, this part of the spine becomes very rigid. And so if something's very rigid and bound down, this will get more mobile, and the lumbar spine will probably get more mobile, and this will get more immobile. So having force distribution through the whole spine can be really, really important so that there's not so much stress going through the neck. Okay, so super important. That's what I was saying about whole body mechanics. Don't just focus on these little guys here. Proprioception obviously is part of all of that. If I don't know where my head is in space and it's flopping about, that's going to put more pressure on my joints. Okay, and breath work. So a lot of us, and that's why breathing is my number one principle, a lot of us do have breathing pattern disorders for various reasons. Yeah, stress, anxiety, trying to hold it all together, bracing here to try and create some force so we feel like we're stable. Incorrect breathing patterns, using the accessory muscles here, these muscles down here, the scalenes, for breathing can obviously destabilize the balance of the neck, because remember this guy, he's balancing on a broomstick, right? So if I'm very, very tight in the front of my neck and I'm overusing them, yeah, it's going to cause an imbalance further up the chain. So looking at the whole structure can be really, really helpful. Okay, so that's what we're going to do today. I'm just checking there wasn't anything else I wanted to tell you. I think that's it. So we shall get started. So as I said, none of this should hurt, none of it should make you feel worse. If it does, please do not do the exercises. And if you're falling into that high irritability category, please do try and find a physical therapist or a physiotherapist. Show them this paper and ask for help and guidance, and even help with things like getting a neck brace, etc. Okay, because there are things we can do. Okay, no matter what state of tone deconditioning we might be in. Okay, so let's get started. We're actually going to start seated. So if you want to sit against a wall or against a chair, if you find it hard to relax without support, then please do that, okay? Please get yourself comfy. Make sure you're warm enough, because we're going to be sitting for a little while, okay? And we're going to start doing some exercises. Now, you'll notice that a lot of the exercises are for the upper back, and the lumbar spine, because as I just said, we want to keep that integrity through the whole spine, not just focusing on these little guys here. So let's get comfortable. Settle yourself in however you want to sit, but it could be quite nice to have the back supported so that these back muscles can relax, okay? Now, if you're happy to do so, go ahead and close the eyes. And it's really important that this is kept really subtle, because what happens is when we try and do this kind of lengthening work or awareness work, we start kind of pulling up and fixing our head. I don't want you fixing your head, because that's just going to cause more tension and pain. So, but obviously I don't want you sitting down here like this either. So try and find a comfortable seat where you can focus on the weightiness of your sitting bones. So closing the eyes and just take a moment to breathe, hopefully or ideally through the nose, but don't worry if you can't nose breathe, you can breathe through the mouth. And the breath is going to be very quiet through the nose, so we shouldn't be able to hear each other breathing. The person sitting next to you shouldn't be able to hear you breathing. And we're just going to follow the breath into the body, and we're going to follow it as it leaves. Now, continue to do that. Just be aware that every time you exhale, the body is going to naturally get heavier. So the gravitational pull is stronger on the exhale. Okay, that doesn't mean I start sinking on the exhale. What it means is that my bones, so my sitting bones, the ones I'm sitting on, are going to start getting heavier into the ground. So tune into the weight of your pelvis, and every time you exhale, can you feel the breath settling into your pelvis and into your sitting bones? And if your feet are flat on the floor, if you're in a chair, can you also feel your feet settling into the ground? So there's a certain amount of weightiness in the pelvis. Now, we're going to talk expansion. Okay, remember, I always say expansion, not stretching. We're not trying to stretch, we're trying to expand. And we expand in multiple directions. So with every out-breath, we get heavier. But in the heaviness, we also get release. So tissues start to expand. So you may, without fixing your neck, you might feel that your spine starts to lengthen on the exhale. You might feel your shoulders start to drop on the exhale. You might feel that your chest starts to open on the exhale. But I'm not fixing any of that. If you start to try too hard and start to push into this neck, you're going to feel the tension. So think of heaviness at the bottom. It's a bit like every time, petals start to open in the morning. So a flower opening its petals. And with every out breath, the petals open a little bit more. And with every out breath, the petals open a little bit more. But they're soft, aren't they? Petals are soft. It's not like a flower goes, fixed. It's soft. And it blossoms. So there's this expansive quality where the head is supported from the pelvis below. And that's what we want to try and tune into every day, is that I'm not trying to hold my head up because it's quite heavy. Even at the best of times, it's 10 pounds. If I've got poor posture, it could be 40 pounds. Okay, so can I find that the weightiness of my pelvis allows my spine to lengthen, and the weightiness of my pelvis counterbalances the weight of my head. Okay, so the head is no longer being crushed down, we're actually lengthening up. It's very subtle, and it's not, to get the head in the right place isn't about pushing it back or fixing it back. It's about lifting the heart space and the sternum so the head naturally comes back. Okay, so just stay with that a few more minutes. If you're trying too hard, you'll feel it. So let yourself be soft. But think about growing with that exhale. So we go down as well as we go up. Yeah, if something goes down, something else is going to go up. If my pelvis drops, my spine is going to lengthen. So 2 more of those. Very soft. Just getting that sense, where is my head in space? Am I collapsing? Or can I feel my heart opening, my shoulders dropping? Now, if you can, or wherever you are, just start to bend those elbows. So as though you're carrying a couple of plates in your hands. Okay, so 2 plates of food. Notice how you did that. So when you lifted your elbows, did you lift from your shoulders? Yeah, so find your weighty pelvis, lift, but the elbows and the shoulders stay heavy. They don't start creeping up and compressing my neck. So here I am carrying 2 plates of food, nicely balanced in my hands. I'm going to think of one arm. I'm going to turn sideways so you can see. So I'm not sitting like this, arching my back. If you're leaning against the wall, you'll feel that softness. So from here, we're going to think of rotating this arm bone and moving the plate of food out to the side. Okay, so that's all we're doing. So I'm just rotating this arm bone. Keeping the elbow close if you can. Just having a look at that. And then you're going to do the other one. Okay, so what's not happening is I'm not doing it up here. I'm keeping my neck long, and I can do both arms. I'm not just doing this with my hands, okay? I'm really focusing on the back of my armpit. Because what do I need to support my neck? I need my upper back muscles to be active. Whereas most of us are used to sitting like this with rounded shoulders. These muscles have got very long and stringy, so they don't have a good quality about them. But if we could train them by first finding length in the spine, so my heart lifts, and then with the correct alignment starting to tone these little muscles, well, they're not so little actually, these muscles of the upper back, could that potentially help my neck? I think so. I think it could. I've seen it happen. So a little bit of rotation. Okay, and then what we're going to do is, instead of having the palms up, we're going to turn the palms in. So I call this train arms because it reminds me of when we're children and we try and be trains. But this train's just going to go forward and back. So again, make sure you're not arched like this. You might want to move away from your wall so you don't bang your elbows. So same thing. How do I become a train? I'm thinking of this general area and I'm drawing back. Doesn't have to go very far. What doesn't happen is that. Can you see the difference? So I can draw back and this stays where it was. But if I'm very mobile, I might get that. And that's what will then start pulling and compressing the neck. So wide collarbones, draw back. When you go forward, this doesn't come with you. So I can draw it back, and as my train goes forward, this has to stay back too. So I'm really focusing on the body mechanics of the supporting structure below my neck. Because if I can get this bit right, my neck and head are going to have a much better chance. So it's not this, yeah, it's not just this. Can you see how unstable that is? Very unstable. But I'm really focused. I'm not forcing it. It's not about who can do the most. Even if you only did that, but it was coming from the right place, fantastic. And then just relax, roll the shoulders out if you can. Remember, none of these should hurt. If any of them hurt, please discontinue that particular exercise. Now, if you've got a band, we're going to take the band. So this one's a little bit more advanced of the exercise we just did. And we're going to hook this over our feet. So I've just put it over my feet like that. Exactly the same as what you've just done. So those of you who are, a little bit further along and ready to take some resistance, same thing though. Palms are facing in, elbows are heavy. as I draw on the band, I don't want that to happen. So is my chest still lifted? Have I arched my back? Okay, those are the potentials that can go wrong. So, do I still feel that expansion? Is my pelvis still heavy? Because if it's not, what's happening? Yeah? So have I still got that lengthened spine that I can then draw back, keeping my heart lifted so I don't start sagging? Because that's what we want to do, right? We get resistance and we collapse. Can you do this so that your head doesn't get pulled forward? Look what happens to my head when I collapse. So I want to learn to do this without my head collapsing, okay, without my bobblehead. Yeah, I want to keep my head on top of my spine. Okay, so a little bit of rowing, very slow, very gentle with my band. And then just have a little relax, let that go. Roll the shoulders if it's comfortable for you to do. Now, from here, we're going to lie down. So I might have to just move the camera down a little bit so you can see me. One moment. There we go. Right, so get yourself comfy. Have a head cushion, of course, if you need it. And settle yourself on the ground. Now, take a moment. See if you can still find that lengthened spine that we were doing when we were sitting. So I know that when I exhale, my pelvis gets heavier, my shoulders get heavier, my head gets heavier, but I'm not pushing. Please don't ever push your head into the floor. Okay, with my highly irritable clients, even doing things like chin tucks, which are often recommended for neck instability, were not suitable. So that's why if I'm suggesting if you're a high irritability client, really working one-to-one with someone is recommended, because so many of the things that we're told to do are just not suitable for people who have got that lots of instability, okay? So just my recommendation there. So as I exhale, can I still feel my spine lengthening? Okay, can I still feel the weightiness? Now, we said that in order to support the head and neck, we want a strong rest of the spine. So we've done a little bit up here. What about the lumbar spine? If my lumbar spine's all over the place, and many of us have very mobile lumbar spines, that's going to make me more unstable further up the chain as well. So let's do a little bit of lumbar stability. So my pelvis, and this is actually a really good little exercise because we're going to be doing a knee roll, which is basically this one. I want you to notice when you do your knee roll one leg at a time, what happens up here? Do you try and collapse, tighten? Do you grip with your neck? Do you clench your jaw? Whatever the things have, lots of things could happen, right? But what we're looking for is that when I lift my leg, nothing changes here. I'm still breathing, I'm still settling. So when I peel one heel off the ground and then lift the leg, my neck isn't impacted at all. My chest stays open. So just this will tell you what kind of stability you have and how you might be recruiting the wrong muscles as a form of stability when you try and perform lumbar stability. Are you recruiting your neck muscles? Which isn't a correct movement pattern, obviously. So what can we do? The heavier the pelvis gets, the more stable I'm going to be here. Okay, so maybe you're at a stage where you're just lifting your heel. If you're really struggling, and when you lift your leg, everything kind of does this, get some books or get a box and raise your legs up so they're higher. So rest your feet higher than they are now, okay, and work at it from a shorter range until, okay, I've got a box underneath me. I'm not suggesting you have your legs in the air, okay? This is an imaginary box that I'm lifting my legs from, okay? So rather than going from the floor I can lift my legs a shorter range, okay? And that's a good way of training these neck muscles to switch off while you work on your lumbar stability, okay? So just practice that. We want to get to the stage where this is so heavy and stable, my neck doesn't have to get involved, okay? Bring yourself back down, walk your feet out and just do a little windscreen wiper if that's suitable for you, just to loosen off any tightness that you might have had around the hips and the pelvis. I always like to just let things go a little bit, with control of course, but I like to let things go after we've done some stability work. Then bring your feet back into a comfortable position. We're going back to our vertical forearms, which is the same as train arms that we've already done seated. So we should be familiar with this. Chest is open, spine is long. Make sure that you're not squashing your neck, so the eyes are looking up towards the ceiling. And we're just going to be floating, like we did with the train, we're going to be floating up. And we're feeling this heaviness in the back of the armpit. Feeling, really important, we feel that these arm bones are in their sockets, they're not up here. And then the heaviness, the stability, brings this back down without that. Now, some people will find that too challenging if you've got a really irritable neck. So you might just be lifting the elbow, which is fine, because you're still working your upper back muscles. So don't worry if you're not able to straighten your arm yet. Just work in a place where you can lift and lower whilst maintaining stability across here. Okay, we'll do one more, whichever version you're doing. We're going up and back down. And then just lower your arms down so you're back in your straight arm position. And we're going to try and lift a straight arm. Soft elbow, soft wrist, keeping this heavy. Again, this might be too much. I'm only going to there, so sort of in line with my face. And then I'm bringing it back. Soft elbows. Check you haven't locked to stabilize, because that's going to put your shoulder in a funny place. That's going to impact the neck. So this has to stay soft, this has to stay heavy, and down we come, okay? Again, if that's too much, just practice this. Can I lift and lower, or even lift a little bit and lower without this happening? Okay, so we're looking for stability in this whole upper back area. We're doing the other arm. Can it stay heavy? Can you bring it back down? Okay, if you're able to do two arms, check those wrists haven't gone floppy, keep everything nice and aligned. Shoulders heavy, pelvis heavy, let that pelvis drop, don't hold tension around the pelvis, and down we come. We'll do one more, whichever version you're doing. Up we come, soft elbows, heavy shoulders, heavy pelvis, still breathing, bring it back, heavy shoulders, soft elbows, heavy pelvis, and just relax. Good, very nice. Now slowly, we're going to turn over. A little bit of extension. So we're going to do a little bit of baby extension. This is obviously working the head down into the upper back. Cushion under your pelvis if you need it. Okay, I'm just going to take these off. So you'll have seen me do this before, because this one goes with our coat hanger pain series, because it's kind of similar, isn't it? The coat hanger pain goes up into the neck and down across the shoulders. So if you settle yourself in, okay, arm position can be whatever works for you. Okay, some people need their hands out here, some people prefer them here, whatever works for you. Give your pelvis a little shake, find that heaviness in your pelvis, and then Now remember, we're not pushing, so it's not me pushing with my arms. Really important for this one is do not look up. So what tends to happen is people start doing this, I can't really demonstrate it, but people start doing this and then they do that because we want to see, instinctively we want to see what's going on. And then what happens? You're crushing the back of your neck. So we've got to keep the neck long, okay? Don't be tempted to do some little wobbling of the head once you get going, okay? So, just seeing what's about. Hopefully you can see my head, okay? So, here we go. I'm going to turn slightly so you can see me better. There we go. Right, so here we go. Don't look up. You should be looking down at your hands the whole time. Remember that lovely long spine. And as you exhale, can you expand? Can you settle? And with every out breath, can you expand a little bit more? My neck is long, I'm looking down. So if you're not looking down at your hands, you've bent your neck, okay? Keep looking down at your hands as you come down, slowly. So you've got to resist gravity, otherwise your head, which weighs 10 pounds, is just going to crash to the floor, okay? So you've got to resist gravity. Again, you might only be going a little bit. If you can only lift up to here like a centimetre, that's absolutely fine, okay? If you can go higher without pushing with your arms, that's great too. Have you kept your neck nice and long? Can you go slowly back down? Okay, we'll just do one more. If you've had enough, obviously stop. Keep looking down, keep looking down, keep looking down. Breathe. Soften, soften, soften. All the way down. And then very slowly, take your time, come out of that. I always like to do a little child's pose after being on my tummy. Okay, so hopefully we kept our necks long and we didn't end up doing that. So, final thing I'd like to do is a press and release. So if you can be on your hands and knees, this is exactly the same exercise. You could do it down here if you don't like being on your hands and knees, okay, if you don't tolerate your wrists. Okay, so remember we started sitting and we were trying to get a long spine. Do you remember? We were sitting and we were thinking about the pelvis being heavy and the spine lengthening away from the pelvis. And we didn't fix and force, but we were expanding. And this might be enough, you know, just being here or here and holding this might be enough. Okay, I'm not doing that. Gotta look down, okay? And you're gonna feel muscles working in your upper back for sure. Okay, so if you wanna do the press and release, soft elbows, slowly lower down, slowly, and then use your spinal muscles to lift yourself back up. So it's not me pushing with my hands, and I don't bend my elbows. I slowly lower down, desperately trying to keep my neck long, and then I lift, like I'm lifting my nose into the back of my head. That will keep my attention on my head. So I lower down, and I lift the nose back up into my head. Now we're not pushing, so don't go jamming into the back of your neck when you do this, okay? Really think you're trying to strengthen from the occiput all the way down between the shoulder blades, but you don't need to force it at the end. Just don't need to do it. Keep it soft. Okay, just do one more. If you've had enough, obviously come off your hands. And then just have a little sit back, have a little rest. Very good. Now come and find another comfortable seat and just, again, rest against the wall if you need to. Let your hands rest on your legs, wherever you feel comfortable. Close the eyes. And just take a moment to just breathe. Again, being drawn into the weight of the pelvis. Feel the weight of the sit bones. And with every out breath, allowing the spine to lengthen, but without forcing. Can't stress that enough. Try not to fix and force yourself into a so-called correct posture. That will only cause more stress and tension. To get ourselves into a correct posture has to involve the whole body being in the correct alignment. If we were standing up, of course, and remember I've got that whole video on feet and feet alignment, you might want to revisit that, because if we were doing this standing up, we'd be talking about finding the correct alignment for our feet first, so that we could then find the correct alignment all the way up to our head. So it's really, really important that when we're dealing with neck pain, neck instability, that it would be a huge mistake just to focus on the neck. We have to look at the whole body integration. We have to do it sensibly and subtly without fixing. Very good. And then just very slowly open the eyes, coming back into the room. Lovely. I don't know what the time is. I don't know how long we've been going, but I hope that was useful. 48 minutes. Gosh, thank you for sticking with me, everyone. There we go. I hope that was useful. Are there any questions you want to put in the chat box before we finish? Or you can obviously leave me a comment on, oh, you can't see me. You can leave me a comment on the YouTube when it's published. But yeah, I hope that gave you some ideas about how to start stabilizing the neck, but really from working from below the neck, rather than just, you know, doing chin tucks and isometric exercises, which do work for some people. I'm not saying there's anything wrong with them. As I say, I do my isometrics every day. Oh, thank you. That's very kind. That's really kind. I'm very glad. So yes, nothing wrong with them, but they're not suitable for everyone because of the instability and the shearing of the vertebra for many of us, yeah? So if I try and do this isometric here, I could be shearing on the vertebra or the head on top of the vertebra, which obviously isn't ideal, okay? So head position has to be correct, and as I said, the chin tucks, in my clinical experience found that for those irritable people, chin tucks and neck pressing and all of that just wasn't working, and it just brought on too many symptoms I did not like, and we just stayed away from them. As I say, I've got a whole protocol that I go through, but a lot of what we did today is within that protocol, and I use these exercises with all of my, well, pretty much everyone, because everyone can benefit from upper back and neck stability, but I do use these with my neck people as well. But as I said, oh, thank you. Wow, that's amazing. As I said, if you're falling into that high irritability category, and as the paper said, there's 5% of us who are in that category, please do seek help from a physical therapist or physiotherapist or neurologist. Some people need to see a neurologist. As I say, you know, none of those exercises are meant to make us feel worse. So please don't do any of them if they brought on neurological symptoms. Okay. So I'm so glad it was helpful. Thank you for the lovely comments. So we'll be back sooner than before, because obviously we're a week late. So I'm here on the first Thursday in March. It's already March. So I hope you can join me for another education and movement session. And yeah, lovely to be with you all again. And leave me comments if you've got any specific questions. Obviously, I can't give medical advice, but I can give you general comments in the comment boxes. So thank you again. Have a wonderful day. Have a wonderful evening wherever you are in the world. And I look forward to seeing you in March. Thank you so much, everyone. Bye-bye.